Minister, I'm contacted on a regular basis concerning the lack of respite services in both counties, Cavan and Monaghan. So currently respite services for both adults and children are provided in Annalea Few House or Respite Centre in Coothill in County Cavan. But because obviously adults and children can't be facilitated together, it's alternative weeks, so adults one week and children the next. But it's not sufficient to deal with the large volume of people who require respite services throughout the two counties. So there's a need for at least 2 centres, even 2 in each county would be brilliant, but at least 2 centres. I do want to acknowledge Steadfast House in Carrickmacross does provide respite as well, but there's demand for their services too. So what I'm asking here this evening is what plans there are to expand the existing level of respite in both counties. Just to say that when Annalea House was closed for repair some years ago, and it was closed for quite a length of time, for a while there was no respite services offered at all, and then Killygowan respite service was opened. Now at full capacity it could only facilitate 5 adults, and I think during COVID that was, or 5 people, I think during COVID that was reduced to 2, and again it was an alternative basis, children one week and adults the next. So when Annalea House in Coothill was reopened, I'm just wondering why wasn't it designated for example children and the other Killygowan house kept open for adults? Because there are so many individuals are refused respite due to the increasing volumes of individuals seeking to avail of the service, and some have been informed that the service does not cater for those with mild or moderate intellectual disabilities. So I think all individuals with intellectual disabilities should be entitled to respite care if they feel they need it. Now, in a recent parliamentary question, it was indicated to me that there are plans to provide separate centres for children and adults in CHO1. And a submission has been made for funding to support these future plans. However, the reply didn't actually answer the question I asked, which was specifically around Cavan and Monaghan. It just gave the CHO area in general. So I suppose I want to know specifically what plans there are to provide additional respite services in those 2 counties, and how far into the future those proposed services are. So I'm receiving many queries regarding respite from families, and they're at the end of their tether. They're families who have children, sometimes with disabilities that are quite complex, and they were in receipt of respite before COVID, but has not been resumed, or certainly not to the extent that they were receiving it prior to March 2020. And many families need a break so they can perhaps do some other activity with other children in the family, or they just need some time for themselves. And children too with complex disabilities might need a break from the family home, and its respite should be arranged in conjunction with the child to ensure that not only are they properly and well cared for, but that the activities are provided they're interested in, so that respite is enjoyable and they look forward to maybe going back and repeating in a few weeks on or whatever. I'm also contacted regularly by aged parents who maybe have adult children with disabilities living with them, and again, really they should be living independently, but often they're on waiting lists, the Housing Council waiting list for our houses for up to 10 years, and no supports have been put in. Now, I know there are moves and that's improving, but we still have a situation where there are adult children with some complex disabilities living at home with aged parents, and they both need a break. The adult needs a break from the home situation, and the parents need a break. So just to repeat my questions, I suppose, what plans are there to expand existing services in Cavan and Monaghan, and the time frame for the expansion?
And I would like to thank the Deputy for raising this important issue. And as you know, I'm keenly aware and critical importance respite for loved ones and families for those with a disability. And I'm deeply committed to expanding respite service, both in terms of quantity of hours and in terms of locations throughout the country. And last year I located 1. So basically, Tully, our Deputy, let me explain it to you like this. When I did the budget in 2021, my ambition was, because of the cost involved in it, that I would provide 1 respite house in each CHO around the country. And we all know that each CHO they could have multiple numbers of counties. So in 2022, that went to 10 to 11 to 12. So I have enough funding to do another respite house in each CHO again, but this time I've built on it. And what I've built on it this time is I have 3 complex needs ones, 2 for medical complex needs and 1 to do with Padda okay, which is costing 600,000. So that in itself, the idea here is to put a respite house into every single county. By the time I leave government, or by the time I'm no longer a minister, my legacy will be I will have built in respite houses. I believe that we need to create capacity. The capacity is needed. We understand very clearly from within COVID one of the issues that parents of children and adults couldn't access respite, and in order for us to ensure that relationships last for as long as possible, give them the night's sleep, give them regular respite, and guess what, we can keep family connectivity to better. So, and as the Deputy is aware, I did meet with you when I was down in Monaghan, but I was down at the request of Deputies Niamh and Brendan Smith, where I also met with Senator Gallagher and Minister Humphreys and Senator O'Reilly. And I was informed by the local CHO in Cavan that the Disability Services provides respite for adults and children in Annalea View Respite Centre, Cootehill, County Cavan, on alternative weeks. I'd be honest with you, Deputy, I was quite shocked to hear that. I was quite shocked to hear that children and adults alternatively have only 1 house in the entire county to deliver respite. It's not how I would deem a fair, equitable access to services. 1 house in 1 county doesn't meet the needs by any manner or means. And when I met in the primary care centre, one of the ladies within the HSE and the Progressing Disabilities would have spoke to me at length about that. And it is something that has to be prioritised, as I say. So, respite services for adults in Cavan-Monaghan catchment area are provided from the Steadfast House, Carrickmacross, County Monaghan. The Annalea facility had previously closed due to major repair works on site. Following the temporary closure of Annalea View and throughout the COVID pandemic, respite continued to be provided in a new location called Kilgowan Respite Centre, Cavan. Funding was allocated in 2022 Community Health Cavan, Donegal, Leitrim, Monaghan, Sligo to develop respite services. The 2022 funding is required to be allocated based on assessed respite service needs across the community healthcare area. This year, Sligo and Leitrim area of the community healthcare area have been identified as the area which respite service developments are required initially. So the question you've asked me is, where's the house going, or what's happening in CHO1? I'm telling you, it's going to the Sligo-Leitrim area. It's not the Cavan-Monaghan. To be honest with you, the Cavan-Monaghan situation only came to light when I was with Deputy Smith 2 weeks ago.